Hi there, I'm Dr. Emily Porter, and I'm a board-certified emergency physician in Austin, Texas. And we're in the middle of the coronavirus pandemic, but I still think that flu shots are very, very important. If not this year, then going forward, until we have a vaccine for this coronavirus, which they're saying might be 2021 to 2022 season. So that's a couple years away, at least a year, if not 2 years away. So flu shots are really, really important in general, but especially during this. Now, I don't want you to rush out and overwhelm your doctor. They're busy doing telemedicine, and if you're sick, you need to stay home. Your pharmacist, your health department, they might be overwhelmed right now. So if it doesn't happen this year, that's okay. But I want to encourage you to get a flu shot next year, because this coronavirus thing might be, who knows how long it's going to go on, and it might come back. So first reason why you should get a flu shot is that millions of people die every year from the flu. Millions. In America, it's not so many millions. It's more in the thousands. In 2018 to 2019, it was about 34,000. So not millions, but certainly more than the coronavirus has taken out, even worldwide as of right now. So the second reason is that vaccines decrease the mortality. They decrease that mortality. So the sheer number of people die, fewer people die. And what happens is that I'm not going to get into the science behind vaccines. I'll do that on another video if there's interest. But vaccines, even if you do get the flu, or you get whatever disease we're vaccinating against, you tend to get a more milder version. You still might have some antibodies, you just don't have as many as to completely prevent you from getting sick. But you get a milder strain, so you tend to recover better, and your mortality therefore is decreased if you have had a vaccine, in particular the flu shot. So the third thing is that it helps flatten the curve for coronavirus. And we talked about that in this other video about flattening the curve. And I've got a picture on the next page, so I want to show you what that means again. So this is the curve we're talking about, flattening the curve. So the number of cases, in this case, we're talking about coronavirus, and then the time over which they happen. And then here's our healthcare system capacity. So that means beds, hospital beds, doctor's offices, gloves, masks, personal protective equipment, ventilators. That was what the big video was about, because that's the huge thing right now, because this affects the lungs. It's primarily a lung and heart illness. Well, flu causes a lot of pneumonia as well. So all of that is the healthcare system capacity. And right now, we are still at a trajectory with our coronavirus as of March 24th, like this. So right now, this is what our curve is looking like. If you look at our curve compared to other countries, we're growing faster, steeper than any other country. So that's super scary. So again, all these people up here above this line, we can't take care of them because we don't have the ventilators. GM just announced today, Ford, that they're producing ventilators, and all these factories are going to help us out. But is it going to be enough time? I don't know. Whether it'll be in time or not. But all these people, they're not going to get the access to the care that they need. So we can't save these people. So we want to flatten the curve. And what the flu shot does is it does this. For coronavirus, it does this. It flattens this curve down. Now, we still have a lot of cases, but we're never overwhelmed in our healthcare system. So why does the flu shot flatten the curve and make you more likely to survive coronavirus? Well, because it makes you less likely to die of the flu. So when I talked in my video about the ventilators, we're talking about maybe best case 150,000. That was assuming that 0% of them were occupied. When in reality, in March in the US, about 2/3 of them are already occupied. So 66 to 67%. What are they occupied? People have heart attacks, people have strokes, people have flu, they have influenza, they end up with pneumonia, they're sick people around the clock. So if we can decrease the number of people that get sick from the flu that need that severe care, we can flatten the curve already and make coronavirus less likely to hurt our people, because we have more healthcare system capacity, because we're not taking care of people that wouldn't have been sick from the flu if they'd gotten a flu shot. Capiche? So in America, that means about 40 to 60% of people in 2017 to 2018 didn't get the flu because they got the flu shot. So it decreased the number of cases by 40 to 60%. That meant 3.2 million people. So it decreased office visits to your doctor by 3.2 million. So your doctor had more time for you. And it decreased the hospitalizations by 91,000. So people in the hospital. And it decreased the number of deaths by about 5,700. So the deaths is not huge. It's not overwhelmingly huge estimated in 2017, but all this stuff, this right here, that's the curve stuff we're talking about. So by having people get vaccinated against the flu, we're opening up space for all these people, and we're not taking up ventilators. So we're flattening the curve by people not getting sick from the flu. So the last two reasons, number 4, is concurrent infection. So if you have the flu right now, in America, at least right now, you're maybe not getting tested for coronavirus, because a lot of the protocols are that if you have a reason to have a fever, they swab your nose and you're flu positive, they're not going to check you for coronavirus. Well, that doesn't mean you don't have coronavirus. It just means we're just going to assume you have flu. So we're probably actually missing a whole lot of coronavirus patients because we're not even testing them, because we're chalking their symptoms up to the flu because they're flu positive and flu is more common. So if you get a concurrent infection with flu and coronavirus, you're toast, man, because you got one thing that attacks your lungs and another thing that attacks your lungs, and you don't have any time to rebound. So if you were to get the flu, you're down for probably 10 to 14 days. Well, then your immune system's probably down for another 2 to 4 weeks. And so if you were to get hit just completely independently with another illness, whatever it is, pneumonia or coronavirus or whatever it is, your chances of dying of that are much higher because you're not at full capacity in your body to fight an infection. So that's another reason. And then the last one is really just something called herd immunity. And I grew up on a farm in Iowa, so herds, we're talking about cows. And when we're talking about herd immunity, we're talking about herds of people. 331 million Americans, and in order to have herd immunity, we have to have greater than equal to about 80% of people vaccinated against a disease. And we don't always get that with flu vaccine. It's not the best. I'm hoping that when they come out with the coronavirus vaccine, that it's a lot more efficacious. But that helps too. And it's not about you. It's about other people. So when you get vaccinated, even if you're not a high-risk person, you're protecting babies and elderly people and people that have asthma and diabetes and all the people that don't have strong immune systems. So that's why we're staying in right now. I'm low risk. I'm 40 years old. On the curves, my mortality is very low, but I'm protecting all the people 60 and over whose mortality is really high. Well, when you get a flu shot, you're kind of doing the same thing. You're not just thinking about yourself. You're thinking about all the other people out there that might not be as well and survive as well as you do. So I hope you'll think about that. If you don't get your flu shot this year, you didn't get it this year, don't fret, but please get one next year. Vaccinations are really important to the greater good of the world.